Hi, I'm Herminia Malonis Pellegrino. Student ID number N41381803. Module name Work-Related Learning. My tutor is Mr. Chichuki Agomo. I chose my career pathway is about midwifery. Midwife do. Midwife mainly deal with the pregnant woman and the baby by the providing the care and support they need throughout their pregnancy journey, pre and postpartum. According to the Nursing of Midwifery Council, includes they provide clinical examinations, identifying pregnancy history, lifestyle, and any underlying health condition which may affect the fetal development while in utero. Monitor the pregnancy from gestation to labor. Provide antenatal classes, labor and birth process, feeding, and newborn first aid. Acts as advocate and support system during birthing and postpartum process. Be the first contact of the mother by giving an advice of the support for any queries and issues throughout pregnancy. Allows mother to have informed decision to their care and treatment opportunities as well as a baby. Ensuring safe delivery of baby and monitoring mother and child postpartum. The Health and Social Care in Sector, London. The health and social care sector provide support, help people have a better quality of life, access to the health care, shelter, and employment. For example, providing care and independence for the elderly or people with condition, requiring equipment, medication, and monitoring in the community. Let's them the health and social care sector in London. The health and social care sector provides support to help people to have a better quality life, access to health care, shelter, and employment. For example, providing care and independence for the elderly or people with health condition, requiring equipments, medication, and monitoring in the community. This lets them have independent and empowered to have a choice in their care needs treatment within the safety of their own homes. Decreasing the loads on the hospitals and other services and lowering costs. The Care Worker Charity in 2019 as a people as seen and treated in GP, surgeries, or local cancer authorities. Their needs are met quicker and they receive access to other health and social care services. They no longer need to go to the hospital and get admitted, which demands supplies and increase the expenses. Link to midwifery. Link to midwifery. For midwives, this means they have provide and evaluate care in partnership with women and their partners and families if appropriate, repairing and to collaborating with other health and social care professional as needed. National Health Service or NHS. What they do. Over recent years, there have been changes to how NHS is structured and functions, impacting the whole of the UK down to its regional and local levels. The NHS has wide range of different roles, responsibilities, specialties to support its clients and employees, like GP, dentist, and care homes, that we can do service to the community. In midwifery, health visitors, midwife monitor the mother and the newborn within 72 hours. This allows for immediate treatment and diagnosis, as they are more vulnerable to infection and babies to congenital disorder. What National Health Service England do? National Health Service in England is a branch in the National Health Service supporting system and provide to lead locally to improve the health of those within the population. This ensure improvements on the quality of the patient care, tackling inequalities, and deliver care more efficiently. National Health Services in 2023. Organizational structure. Organizational structures is how activities such as task allocation, coordination, and supervision are directed toward the achievement of the organization's aims and vision. Organization structure affects organizational action and provides procedures and routine tests. An organization consists of the company, employees, manager, and board of directors, which makes up the business internal stakeholders. This means having multiple branches, departments with different roles, responsibilities, and specialties for the National Health Service. This provide variety of support to the patient and carers with regards to their health and social care requirements. The healthcare formalize the mergers of a number of National Health Service organization, including a National Health Service in England, Improvement Health Education England, and National Health Service Digital. Organizational functions. In the UK, the government funds the National Health Service through taxes, percentage from national insurance, prescription charges, and dental charges. The government also decides the annual budget it's given to the National Health Service from staff salaries, development and opening of new services in hospitals, and other expenses required in running hospitals, GP surgeries, and dentists. National Health Service England is national single regulatory body overseeing plans, delivery, transportation, and performance of the National Health Service, healthcare services in England only. This include but not limited to commissioning and buying of services to improve access to health and social care services. Progress, GP appointment, data analytic, continued progression of GP contracts and any GP workforce issues and in national health services in England. In organizational cultures, the National Health Service organizational culture includes setting mindset, abilities, system, and structure so the organization can establish a clear action path forward to plan and move forward the culture that fuels organization cultures. Organizational cultures. The National Health Service organizational cultures includes setting mindset, abilities, system, and structure, so that the organization can establish clear action path toward to plan and move towards the culture that fuels the organization's success. Healthy organizational culture in NHS is now accepted as it is a vital point in delivering a high-quality patient care. The King's funds, principles, and fundamentals in having healthy organizational cultures, which include inspiring vision and values within its workforce, setting goals and performance evaluation, providing support from leaders and seniors with compassion, having a good learning environment, researching of innovative solution, effective and efficient teamwork through communication and planning, collective leadership. Stakeholders, who they are and what they do. A stakeholder is anyone that is impacted positively or negatively by a service or intervention. They are the center of the healthcare system and would be significantly affected by changes within the system. And would be stakeholders includes the patients, practitioner, employees, insurance companies, pharmaceutical firms and equipments and stock manufacturer, and the government. National Health Service in England is responsible for providing a unified national leadership, is a single regulatory body responsible for overseeing the funding, planning, delivery, and transformation and performance of national delivery, transformation, and performance of national health services such as in hospital. Employees, the company are invested in the company's performance to ensure they continue to be paid and retain their jobs. Depending on the nature of the business, employees may also have health and safety focus. Organization and stakeholder working together. The National Health Service Organization and its stakeholder work together through shared decision making and face challenges that may arise within the health and social care service. For example, monitoring latest bills, policies, and legislation and impact the health and social care sector. The National Health Service and its stakeholder must ensure the best possible outcome of their service user, the taxpayer, and the partner, National Health Services Institute for the Innovation and Improvement. By utilizing the NHS leaders and stakeholders, a project to improve services and start changes with the system can begin. This is done by commencing a project analysis to engage the stakeholder, consisting of providing a statement, evaluating an effective communication method, and timing involvement of stakeholder in various parts of the project, and overall ensuring a project success. NHS Institute of Innovation and Improvement. Organization and stakeholder. The organization and its stakeholder have regular meeting to tackle issue, determine current services, effectiveness, and take part in its shared decision-making process. Health and social care service has a complex mechanism involving people in different organizations responsible for different parts of policy setting and provision. This meeting comprises of robust evaluation and critiques of policies and acts between members of Parliament and National Health Service. Leaders to support in testing solution and assess impact of this act in the front lines national health services. Decision making in integrated care system continues to develop alongside latest innovation to develop trust and cooperation between the national health services and stakeholders. Thank you for listening.